Good morning. 1027, 1035 WICY inside the community on Wednesday mornings, 9:40. We're joined by those from Hyde Medical Center. Really a carousel of people we've had lately, which is really nice, the variety. But Matt Jones, what are you, the Chief Operating Officer there at Hyde?
I am.
That's
Good morning.
It's quite the role, and good morning to you. Now, I know you've been very busy lately. We have a few different topics. We're going to start right off with it. COVID-19 vaccines, the hot topic. It's growing. They're getting released. What do you have on it?
Yeah, this is definitely an important week for the pandemic response. As you've probably heard in the news, there's 2 potential COVID-19 vaccines that are coming out, and they're going through the final steps of the FDA's emergency approval process. Tuesday, we're going to learn more about the Pfizer's vaccine, its safety and effectiveness. And then an important date on Thursday is going to be when there's going to be a public debate about whether or not the safety of the vaccine is something that the FDA should approve for that. So definitely something that we should pay attention to. I'm not a medical expert, but I definitely feel like the public in listening into that stuff will help try to answer questions that people might have about the safety of the vaccine and whether or not that they should get it. I think another important piece that people should also know to do is reach out to their providers, their physicians that take care of them as well, and ask them questions that they might have. There's been a lot of information that's being passed around the medical circles as to the vaccines that are out there and if they're safe and effective and ways to go about that. But definitely an important week for our COVID-19 pandemic response this week with the vaccines potentially coming out.
Well, we look forward to just each and every week now getting updates from you guys on the word of the vaccines, and it's growing. It's really exciting, which is crazy because it's just how long we've all had to bear through this. Now, and when I say us, let's get a little more specific here in Franklin County. We're now, we have a record 104 active cases. Here's the effect of the Thanksgiving surge, right, Matt?
Yeah, we had, as of Monday, we had 104 cases. I believe Tuesday there's 119 active cases. So we're seeing that number continue to grow day by day. We are in that range of about 10 to 14 days after Thanksgiving, the Thanksgiving day, and sometimes there's correlations that can be looked at from that. So definitely a big time for Franklin County and New York State in general. I know Governor Cuomo is putting out some new information about making sure that hospitals can reach some surge capacities. The great thing is I know here at Hyde we did a bunch of work in March and April to actually be able to increase our emergency capacity up to 50%. So we already have plans in place to be able to do that on an emergency basis. So the good thing is with those plans and a lot of work that we put into it, we're already going to be able to meet those guidelines that the governor is going to put out. And, our hope is with those plans to be able to meet our community's needs for any hospital care that might be needed.
Well, I'm going to give you the platform and spotlight for you to say something a little extra here about those you work with.
Yeah, so a big piece that we've been working on here over the last month and a half is really down at the Alice Center. We did have some COVID cases that occurred with some of our residents and some of our staff members, and the care that the Alice Center staff have been doing down there for both each other and for our residents down there has been next to none. Their compassion, their caringness has definitely shown in this last month and a half for the work that they're doing down there. It's definitely not an easy environment to always work in when you're dealing with COVID residents and also sometimes COVID staff members that are out of work and sometimes becoming a need to help take on some extra shifts and stuff. But the Alice Center staff have definitely done a great job with really stepping up to the plate, doing as much as they can, caring for the residents. It's definitely a tough time for both the residents and their loved ones. But we've also had a lot of support from the residents and their loved ones as well. We try to have daily communication with them, and the families have been so supportive of the work that's been being done down there. So definitely wanted to put out both an appreciation to our staff members down there and also the families and residents that we care for at the Alice Center.
All right, Matt. Well, we're happy you had to do that because we don't really know what the inner workings of what goes on. You see all the hard work that's put in, so it was very nice of you to do that opportunity right there.
Yeah, no, I appreciate the time, John, and definitely something that as a community, it's another one of those times that we need to pull together as much as possible. We need to continue to practice safe social distancing. limited the amount of gatherings that we're going to and the size of those gatherings as much as possible. It's an important time in this COVID-19 pandemic. How we respond to it, and this is the second surge that a lot of people have been talking about. So I think as long as we continue to be strong as a community, as we usually are here in the North Country and in Franklin County, we're going to work together and pull through this.
Let's keep on keeping on. Thanks again, Matt. We appreciate you.
Thanks, John.
It's 1027-1035 WICY. That was Matt Jones, the COO of Alice Hyde Medical Center. An update out of Alice Hyde Wednesdays, 9:40, right here on the North Country's Christmas music station.